Hi, my name's Natalie Phillips. I'm Clinical Manager at Haddenham Healthcare, and today I'm here with Mark Pearson, who is one of the clinical team at St George's. Mark's been with us today modelling some of our Eto garments, and we are just going to spend some time chatting about genital edema and what it means to manage it from a clinical and patient perspective. Welcome, Mark. Just tell us a little bit about your background and what's brought you into the lymphedema world.
So I am a MLD therapist by trade. That's my qualification, and I work at St George's Hospital as the primary and paediatric lymphedema clinic coordinator, which is a bit of a mouthful to try and introduce, but I work with Professor Mortimer, Dr. Gordon and Professor Mansour in their diagnostic clinics. I also have therapy clinics with the nurses and the physios and the OTs there. And also I run some clinics in the decongestive lymphatic therapy, bandaging, that sort of. So I see a big range of patients from what their needs are, from when they get diagnosed right the way through to bandaging and then into long-term hosiery care. So yeah.
Oh, brilliant. Really busy time,
yeah,
busy clinic.
It is, full-time job, definitely. Yeah.
And just tell us a little bit about why you've chosen to model our Eto garments.
So I've been measuring people for Eto garments for many years, successfully and unsuccessfully, with different pitfalls that you get to walk into, but I've never worn them for a start. And also I think there's a definite gap out there for guys that want to model this kind of stuff, because if you have genital edema or midline edema, you don't want to show it off. Mm-hmm. So there's not much evidence of what they look like. But when we're trying to convince someone they need to go into compression, we've got very little to show them other than a pair of shorts, which isn't the same as a photograph because they can't compute the two. So yeah, put my body forward for medical science.
And that's great, because it is important that, just particularly when we've got gentlemen, that they see a man modelling those garments. So really, really useful to. This
is true, yeah, because you think you can imagine what you're going to look like in a pair of shorts, but you can't until you see it. So yeah, that's definitely right. Yeah.
And what do you feel is good about the Eto garments in terms of how you use them within genital edema or just lymphedema in general?
So the Eto fabric is unique as far as I'm concerned. There's nothing to match it. It's stretchy and it's light and it's able to conform around most body parts quite successfully without rubbing. I think some of the athletic compression is the closest to it out there, but as far as medical compression goes, it's on its own when it comes to the midline. And that's so it's always a go-to because it's next to an area that's really quite sensitive. Most guys and some women don't even have any tight fitting underwear on their tummy, so you need to pick a fabric that does sit nicely, that is woven properly and there's no seams that are digging in and that kind of stuff. And Eto just ticks the box for those kind of things.
Good. And do you find sort of that you have to do you have a difference between how much you'd go off the shelf, or would you always tend to go custom made with them?
I think respectfully the guys and girls we see at St George's are of a varied shape and size. So whilst we get to know the garment range from an off-the-shelf or made-to-order point of view, our brains can go outside of a different body habitus, if you like. Not just the swollen body part, but the bit that it's got to attach to, and therefore the ability to have a garment that not going to have to squeeze someone into just to get the compression on a different bit makes Eto pretty good going. Yeah.
And what do you think are the challenges that we all face as clinicians in managing those patients that have got genital edema?
I think what I've just said is that was one thing, is that it's what it's attached to. Do they have a big tummy? Have they got saddlebags? Is there a bit missing? Is there one side bigger than the other? And that consideration has to come into the fact that the genitals are in the middle there somewhere, male and female. And that sounds obvious, but it's not just that bit that needs compression. It's got to be attached to something else. So whether they can take a waistband because their body shape is conducive of that. Whether cycling shorts can work because the thighs are too big, or whichever, or if they've got lymphedema in all of their legs, how far does it go down? So the trickiest thing is getting the right compression because of where it's attached to. From that side of it, and then there might be dressings and there might be bandaging as well. So you need some flexibility with how you're compressing it, because it's not always directly on the body.
And you quite often sort of add in things like pockets and to places to put different padding and things.
Definitely. I mean, some of the female genital compression does need extra reinforcement down there, and the ability to put a pocket in, to put a silicone block in, is helpful because they will slide about. And whilst when it comes to certain types of swelling in that area, it does need to be as close to the skin as possible. But not many ladies like the feel of it. I know it's washable and it's not transferable, and risk infection, cross infection is low, but it doesn't feel very nice. Whereas if you put it inside a garment, and you don't have to think about it moving about, then actually it makes it a whole lot more able for them to comply and to wear it. Same with padding as well. Sometimes we can put extra padding in different areas just to try and lift and support where the swelling is, and the ability to do that's great for it. So,
and also having that cotton lining, that
definitely, it's
just quite breathable, isn't it?
Yeah, the seams are great as well. Their seams don't as long as they wear the garments not inside out, because that can happen. So if they wear the garments properly, then the seams are really soft on the inside, and you don't know you're wearing them. I can vouch for that because I've just tried them.
And what do you think is what advice do you give to patients on tips and tricks for managing their genital edema?
So the go-to for us is, apart from the main cornerstones, which is weight management, skincare and compression, and exercise. I think those four, if we can nail those, but the little tips that we're using, that we can use are to empower them to look after where those cornerstones are ticked. So yes, they wear their compression, yes, they moisturize, yes, they try and lose weight, and yes, they try and keep active, but particularly you might need to bandage that area. You might need to think about some days applying compression to the penis or the genitalia or to the mons with tape or something like that. So it's just giving them little bits of, yes, you've got to wear your garments every day, but actually you can bandage a couple of times a week or through the night, just to try and reshape it to work with the garments. Sometimes the support needed from the garments is enough to support the bandaging. So some of the scrotal supports that you do, we can get quite a lot of bandaging around the male genitalia, and then that can support it. Whereas a pair of boxer shorts that they might buy from M&S, it will just fall about because it's not designed for something so bulky. Because our bandaging does make things bulkier. So, in answer to your question, I think bandaging and tape is a nice little trick that they can put in. Self-lymph drainage is always difficult to convince a patient that it works. We know it does, and we're constantly trying to use different pathways to try and explain to them, this is going to make what's working work better, rather than correct the failed stuff. So we need to clear the pathways ready for when you do wear the compression and you do your movements and your four cornerstones of lymph management, that the lymph's actually going to move somewhere. But it's convincing the majority of patients that it's painstaking and it's slow and it's not massively visually different, but it definitely gives the building blocks to it. And we try and support as much as we can with the clinic time that we have to the self-lymph drainage classes, but it's a tricky one.
It goes back to some of that discussion we were having earlier as well about the psychosocial aspects of lymphedema as a whole, but having a genital edema and I think sort of saying that in the time you've got, not being able to necessarily really spend as much time as you'd like.
One of the things, I've been in lymphedema for about 12 years now, and one of the big lessons that I learned early on is to not to put down somebody's lymphedema. Oh, don't worry, it's just your hand. Don't worry, it's just your leg. I see a lot worse. You don't say that to people, even though they might think it while they're sitting in the waiting room. So when you're talking about arms and legs is one thing. When you're talking about genital oedema, there's a huge psychological aspect with it that we don't always get time to fully explore, but it has to be tapped. You have to know what the patient's expectations are. Are they sexually active? Are there wounds? What kind of management does it need? Because if they're not worried about the size of their penis because they're not sexually active, for example, they might not be worried about bandaging it. It's about damage limitation, so they can sit with a pair of Eto shorts. But if they do want to make sex more comfortable, they're going to have to bandage it to bring it down to a certain size, for example. And if there's wounds leaking from some scrotal tissue or from labial tissue, it's going to need some kind of extra support because they don't want the risk of infection. So you've got to just go down this psychological route. And in some of the time constraints we have in clinic, it's really difficult. And some of the research that I've done, we did a little study a couple of years ago, and it's one thing that's missed time and time again because we've got other things to get them measured for. But if you miss that side of it, then often the whole solution doesn't work because you're not working towards what they want or what they need.
Mm-hmm. It's almost, like you say, tapping into that, what is going on underneath.
Definitely.
And I always keep that at the forefront of everything because of even when a patient's non-concordant, there's something else going on.
Definitely, always, definitely so. And they may not feel comfortable. You think they might be, and they say they don't mind because they've been zapped and pulled and looked by loads of doctors, and then they've landed in front of you in your therapy clinic, and you'd expect them to just be open, and they're not always. And as clinicians, and we need to be aware of that you do have to open a few questions up to get the right answers. As embarrassing as it is for you and for them, you've got to explore this. I think it's imperative. And with children, you've got added issues with parents that might have their own agenda and stuff, because the child will just generally do what it's told and put its garments on. But does it need to wear a garment? Is massage enough? Is skincare enough? Do you know what I mean? But parents will have a skew on that, and then that's basically getting inside of their minds as well to say, no, this is exactly what we're going to be doing because this is what the child needs, not what your preconceived idea of it is. So it's just talking and that's getting the most out of your clinic time.
Absolutely. I think just coming back to sort of the what we've been doing today, looking at the genital edema products and the Eto range of products, I think it's good to just remind people that there is a whole other group of products that are different to the flat knits and the circular knits.
Definitely.
In those instances are really, really quite useful.
Definitely, and that does put the product unique. We can't deny that. I don't think there's much out there that can even come near it when it comes to what you can do with it, with pockets and flies and seams and stuff. But the fabric itself we're able to be that versatile with children and people with different shaped bodies and certainly different types of genital swelling. Definitely.
Well, thank you, and thank you for today.
No problem.
And it's been really lovely.
Lovely. Thanks for looking after me. Cheers. Thanks.